Assalamu alaikum everyone, this is Yusuf Khan from Biggest Invest Turkey, and as you know we've been getting a lot of questions from our investors and clients about general things, so we thought why not start a podcast series answering all of those questions. And today we're going to talk about the Turkish healthcare, and I thought who better to ask these questions rather than Mr. Erkut, our licensed expert and at the same time our co-founder. So welcome Mr. Erkut, how are you?
I'm doing fine, how about you?
I'm good too. So, Mr. Erkut, one of the most important questions, is Turkish healthcare really free?
Yeah, which is the most frequent asked question actually regarding the healthcare system. And in Turkey, the health is free, but somehow free, not free for everybody actually. Let me give you a detailed information regarding to the Turkish healthcare system. Because in Turkish healthcare system there are four different kind of healthcare that the citizens of Turkey can get benefit. The very first thing, I'm making this group to make it simple for you guys to understand it indeed. So the very first thing is green card, which is totally free healthcare, and this green card is being provided for only people who are able to claim, who are able to prove that they are poor and they have no money to maintain their homes. So government provides a green card for those people to get free health services from any government hospital. Okay, this is the very first one.
But you have to prove that you cannot provide for it.
Exactly, you have to prove it with the required documents. Another one for the business owners, which we call in Turkish Bagkur. So if you are a business owner, your insurance will be paid by yourself, by your company actually. So your company will pay for your insurance, which is approximately 1,200 Turkish liras in this year. Yearly. This is monthly. Yeah. So approximately 1,200 Turkish liras monthly, which is paid by the company that you own. And this is not only insurance, this is also your retirement. So after a certain date of payment, you will be eligible to return your retirement salary. And there is also specified age limit for it, which is 65 for the male and if I'm not mistaken 60 for the female. So once you reach this age and once you fill the required date of payment, which is approximately 7,000 working days, you will be able to start collecting your retirement salary from the government. And plus, during this time period where you are paying your monthly Bagkur, you are also free to get any kind of health service at any kind of government hospital. So the last two ones are actually the same thing, which is called SGK, and this is applying for the employees, for the people who are working in the companies. So these people are being insured by the company which employed them. And again, the cost is approximately the same, 1,200 Turkish lira per month for the SGK, and it covers the full health care in all the government hospitals again. And this also provides the retirement salary as well after fulfilling 7,000 working days plus the age limit, exactly same as the Bagkur, 65 years for the male. So the payment of this SGK being mostly being paid by the company that employed you, okay? Not from your salary. This is usually how it is in the market, but it depends on your working contract. Sometimes they make contract from the gross, so it will be deducted from the salary. Sometimes you agree on the net salary, so you collect your net salary.
It depends on you and your employer.
Exactly, that's how it is. And another one is for those actually most of our investors are making, which is called GSS. This is actually exactly providing the same features of SGK, free healthcare at all the government hospitals, but you are paying monthly. In this year, monthly you are paying 107 Turkish liras, and you have no retirement because, as you see, this is almost 1 out of 10 of the SGK.
Yeah.
So you have only free healthcare at any kind of government hospitals. This is what usually people who have no work and who have no business and who has no need for money, this is what they do actually. They give 107 lira and monthly, and it covers their all the healthcare.
Okay.
And by the way, you didn't ask, but let me also give this information. I'm pretty sure people are having this question mark as well. Is it going to cover the whole family? So yes, if any member of the family, in terms of wife and husband, if husband has Bagkur, it covers the health care of the wife and children up to age of 18.
Yeah.
If they are still studying any university, then the age limit goes up to 24. Okay. But if they have no school registry after 18 years old, then they are not included with the insurance of the family.
Okay.
And same for GSS, same for SGK.
Okay.
If one member get insured, it covers the family and children up to 18 years old. If they are studying, up to 24 years old. All right.
Okay.
And however, for the retirement, there will be only, of course, one retirement salary. But if both members, wife and husband, are working at the same time and they are getting insured at the same time, so they will have two retirement salaries.
Makes sense. So this was for Turkish citizens. Now, as you know, we have a lot of foreign investors, and what kind of insurances do they prefer?
Well, for foreigners, there are of course lots of private insurance packages from several companies. They are all offering different packages. If you ask about our investors, if it is not a citizenship investment, we also of course guide them to the reliable insurance companies and help them to get the offers. If our investor is looking for a citizenship and willing to live in Turkey, of course we help them also for having these governmental insurance packages as well as the private insurances.
Okay, makes sense.
Yeah.
Now, last question. Mr. Erkut, you're Turkish. You would know about this better than me, and our investors too. In your opinion, is Turkish healthcare really good if you compare it to other countries?
Well, I have lived in US for a quite long time, so that's what I can compare. Our healthcare system is definitely very high quality, especially our teams, the doctors and nurses are very high quality and very well educated. They have too much experience actually. So I can basically say any kind of illness I have, I will never think about having a treatment abroad. I would definitely choose the Turkish doctors, Turkish hospitals. In Turkey, most of the government hospitals are also having all the high quality equipment which are necessary for any kind of treatment. In terms of cancer treatment, Turkish hospitals are very well improved and they are offering all the equipments and the other necessary stuff for the treatment.
What about affordability?
Affordability, for example, cancer treatment is totally free in the government hospitals. So even in the private hospitals, government is covering some portion of the costs. You only pay for some extra, for having a much fancier room, etc. So in the medicine is being provided by the government. This is very important. Also for any other illness as well. Most of the medicines, I can say 99% of the medicines are being provided by the government. Your insurance is covering it.
Okay, so that answers our question, I guess. Turkish healthcare is almost free. Almost.
Yeah, almost free. That's
like
what we
95% free.
Yeah, for example, the package GSS, monthly only 107 lira.
Yeah.
You can visit government hospitals countless. Right? There is private insurance package, for example, you pay yearly 1000 lira, but you have limited doctor visit within this package.
And you can go to only selected hospitals.
Of course,
Yeah.
of course. These are also considerable, but I can say for 107 lira, visiting as much as doctor you
Yeah.
want and getting as much test as you want.
It's almost
is
free. It's almost free.
almost
If you compare it to countries like America.
Definitely.
Yeah.
Yeah, in
So-
US, even if you had an emergency, if you, let's say, pass out on the way, and if somebody calls an ambulance for helping you,
Yeah.
you are responsible.
You're
to
gonna
pay.
wake up and look at the bill and
Exactly.
go
which,
back again.
Which
yeah.
happened a very close friend of mine. And so this happens, unfortunately, especially tooth treatment, dental treatment. In Europe as well, it's very expensive. During summer, for example, we have lots of Turkish origin Europeans.
Yeah.
So they are all coming for their dental treatments.
And hair
in
transplants
Turkey.
too.
Exactly.
Turkey
These
is
are
a-
already famous, I think.
Yeah.
Our audience already familiar.
Cosmetic surgeries and everything.
exactly.
Turkey is famous
with
for
the
its healthcare. Yes.
definitely.
So thank you so much, Mr. Erkut.
My pleasure.
You answered all of the questions. It was great talking to you. I hope all of the questions that our investors had, they're answered. Thank you so much for being here with us.
Yeah, it was my pleasure. Just stay in tune. If you have further questions, right?
Yeah, just
What
comment
you-
them
what
down
you guys
below
think?
or contact us on the WhatsApp number given on the screen.
I'm
and-
here. I'm here to help you guys.
Yeah. Until next time, take care of yourselves. Assalamu alaikum wa rahmatullah.